Well, the pandemic is definitely wearing on all of us. And coronavirus fatigue, that's a real thing. As firefighters, you probably feel like you've heard everything there is to hear about coronavirus already. But there's actually one story you haven't heard yet. That is the recount from our own firefighters about how they went through the very worst of what COVID-19 has to offer. And that's a story worth listening to.
The stories are eerily similar.
Imagine that very deep cough. You really have to dig deep. That's what every cough was, and once you started, you couldn't stop it, or I couldn't stop it. So it was like a.
The coughing fits were so bad, I simply couldn't breathe around them.
The breathing part, that's the main thing. Everybody has the other symptoms. Once you bring the respiratory aspect into it, it's a game changer. It's terrifying.
Yet also very different.
I didn't see why everyone was making such a big deal about this virus. And then the coughing started, and things went down very, very fast.
Everybody's surprised that I got it, and that I was too. I thought I'd be one of the people, if I did get it, I'd have for 2 days and be fine.
These symptoms kicked in after I was, diagnosed with rhabdo, and then the COVID reared its ugly head.
There is no rhyme or reason to why COVID-19 affects some people with mild to no symptoms and lands others in the hospital. Battalion Chief Walter Dillion, age 51, hospitalized for 10 days, recovery time 3 months.
And I felt like I was a fairly healthy person. I try to eat right, I exercise, I try to do the right thing. I don't smoke. I didn't see me as being a high risk. So I thought if, I would be able to weather it, and I simply couldn't do it.
Driver-operator Michael Redmond, age 28, hospitalized 6 days, recovery 6 weeks.
It completely took me out. I lost 17 pounds in a week and a half. I'm still trying to gain my weight back, my strength, my endurance. So.
Firefighter paramedic Raymond Gosa, age 34, hospitalized 5 days, recovery 3 months.
I am not in control of this thing. I thought I could try to will myself out of this, and that wasn't the case. I thought I could, fight through this, but no, this is you are, at the mercy of whatever this thing is going on. That's this novel virus that no one has ever seen, and no one really knows what it is and how it works.
Raymond Gosa of Station 30 remembers vividly in what he calls high definition how close he came to being placed on a ventilator.
I see probably 5 or 6 people gowned up, ready to go, and I'm like, what's going on? It's like, well, we're taking you to ICU. And I'm like, really? It's like, is that bad? And she's like, yeah, you need someone to really pay close attention to you.
All of a sudden, instead of the person providing care, he was the patient.
That was when things started getting real, because now I'm on this side of patient care where it's someone else on that stretcher. It's someone else who's being on the monitor. Now it's me. They put me in the room and I just see all the equipment coming. They put a nasal cannula up my nose at like 40 liters a minute, 40, with a non-rebreather. So imagine sticking your head out of your car window going down 95. That's what this was like.
But he still got worse.
Respirations were probably sustained over 36 to 37. My heart rate was 40. And I'm still with it. We run fire calls and we run extrications. We have bunker gear, we got equipment, we got crew. I know what to do. We run medical calls where we have the best protocols, the best team, and equipment. I know what to do. But this, what do I do? With no gear, no protocols, no interventions, no bunker gear. What's protecting me from going down right now?
Doctors told Gosa he would have to lay prone or they would be forced to intubate him.
Tell them not to intubate me, because for me, that equaled demise. That was death. I mean, it's like, you kidding me? I'm 34 years old. Like, I'm not 84. I'm 34.
Gosa remembers every detail around him. One, in particular, had a major impact on him. He heard the doctor say, 1 hour.
I never thought that it was going to come to this. When someone says 1 hour, that's where you visually see the hourglass tip over and the sand starts dropping. And I started to ask myself, how did I get here?
All the while, his mind is racing.
But I come to work every day. I work hard. Why do I have an hour? I have 3 young kids at home. I want to walk my daughter down the aisle. I want to see her walk down and get her diploma. I want to hold my son's hand to his first day of kindergarten.
But he eventually did it. With a prayer and a will to survive, he was able to lay prone.
So with everything in me, I knew if I started coughing, they were going to tube me, because that's what I was afraid of, because they were going to see this literal drowning and choking from the inside, and I didn't want them to see that. So with everything in me, I rolled over.
For firefighter Gosa, the hardest part was over. For each of these firefighters, there was still a long road to recovery after the hospital.
I'm still nervous. I'm working out and everything now, but I can still feel the stretching in my lung. Still have the presence of COVID in my lungs.
It took so long, to get back to normal. Making a sandwich left me breathless a month out of the hospital.
A resounding theme is gratitude for their brothers and sisters who helped them out, stood by their families, and the fire department behind them.
I can't thank the fire rescue family enough for what they did. I don't know if they'll ever know the magnitude of what they did behind the scenes, whether it was the meal train.
I've had tons of support from Chief Coyle, the fire chief. Everybody I've ever worked with has reached out to me, and it's awesome.
Coyle got on the phone, got him all kinds of heavies at the hospital contact, the direct nursing station, the woman in charge of the floor, found out who our doctor was and how to contact them. And he called every day.
So what's their message to our people? Be aware and take care of yourself and those around you.
This is not a state of paranoia. Okay, I'm not promoting being paranoid, but I am going to say, you do need to be prepared, and you should have a plan should you be the person that falls ill with this. If you have a hard fire, you got to watch yourself now, because you're in that gear and now your immune system is lower. If you have already been exposed and have been asymptomatic, that's something to consider.
It's not worth not wearing a mask. It's not worth not wearing your half mask, showering after these calls, deconning the trucks.
I am still very, very careful where I go and the PPE I wear. If anything else, just to set an example to those around you.
Through the experiences of Chief Dillion, driver-operator Redmond, and firefighter Goza, we can see and feel just how devastating and long-lasting COVID-19 can be, not just physically, but emotionally as well. The reality of COVID-19 is that while we know that people being infected with compromised immune systems are at greater risk of substantial health impacts, we just saw how Dillion, Redmond, and Gosa, 3 perfectly healthy and active firefighters, were critically impacted not just in the short term, but over an extended period of weeks and months. The emotional toll taken not just by the individuals infected, but by their families, friends, and co-workers is immeasurable. For me, I can specifically recall being told by one of our chiefs that he received a text from a firefighter in a hospital saying, "Please don't let them intubate me." This firefighter was in a hospital all alone, without family, without an advocate from the fire department. It was just him, short of breath, fatigued, frightened, and all alone, facing what he thought was his last days. I still get chills thinking about the helpless feeling that night and the days to follow, hoping and praying that he would pull through. Thankfully, he did. I'm asking that you please take heed of the precautions and guidance given by the CDC and fire rescue protocols regarding COVID-19, and let's work to stop the spread of this virus. Our community, family, and friends are counting on us.